and welcome to the Health Wrap. I'm Carla Winfrey, and my friend over there, my sister friend Carolyn Sawyer. How's everybody doing? We're glad that you have joined us today. And Carolyn, there's a lot going on as usual while we're in the pandemic. We've got directors of public health quitting. We've got employees suing colleges. We've got the largest conference in college football punting the fall season. No gridiron action that's going to take place. We've got essential workers, firefighters. We're going to look at some video and they're going to show us how they keep safe. We also are going to meet an emerging artist today, and she's going to talk about how she penned a song related to summer 2020. So there's a lot going on, and we're here with the Health Rep. We're going to start off talking about football. Now we know this has been we live in the South. We know it's big. It's big in the North. The Big Ten and Pac-12, they have now postponed football. So when this happened, everybody started going into a tailspin because you're talking about schools that are more northern type schools for the Big Ten. And so they're saying the Big Ten commissioner is saying that the health and the safety and the welfare and mental health also of the students is more important. But it's really interesting. I think about this, Carolyn. It was back in when the pandemic first started, when they started talking about football, and then Morehouse became the first saying, oh, we're not gonna, do this. So now the big conferences are talking about it. But what they are going to do is have the intramural sports like flag football. So Carolyn, I mean, you still with flag football, you're not knocking anyone down, but you're still in close contact. I mean, what do you think about that?
Yeah, well, first let me just say I am a Pac-12 girl and respect the decision that was made. Washington State University alumni, and while football is very important on that campus, and universities make a lot of money, I think they made the right call in doing this. Though overall, Carla, there seems to be a sense, and I had this thought earlier this week, and that is that people are almost at a crossroads and they've got to decide whether or not I came to this conclusion as I was watching all the traffic returning, morning rush hour, and
Mm-hmm.
even traveling. The airport is no longer a bowling ball. There are people that are taking flights. And I think people are at this point where they're trying to decide, am I going to live life, take the risk, because I don't know when this is going to end, and particularly as it relates to their livelihood, or do I continue to stay in quarantine? And so I think that's why you're seeing some players like the quarterback at Clemson, who's been leading this whole online initiative to get folks back on the field. I still think that we've got to move with caution. Life is a risk. Yes, every day there's a risk, but we've got to move through this pandemic with caution and take all the precautions that the public health authorities are telling us to take.
I know I talked to one of my friends that was at Northwestern and another friend that was at Penn, and they said, although we're disappointed, we totally understand. But you mentioned Clemson, which is in the ACC, and you've got Duke and Florida and all these other Southern conferences. And right now, they're still saying they're going to play, which is interesting. You've got Georgia, you've got Tennessee and Florida that have had like emerging cases. And right now they're still saying play. So I guess we're just going to have to wait and see what happens.
I think I get the question that people are confronted with when it comes to their livelihood and supporting their families. I don't know that I get it on football. And I get how much the universities make, but I don't know that I see it as a life or death that we've got to be out on the field this year. There's next year.
Absolutely. Okay, so let's move on. So, Carolyn, this is down in your part of the country.
Yeah, and this is an interesting story. I mean, if you look at the football piece and you also look at this is campus workers who are in the UNC system in North Carolina. They're actually suing the Board of Regents there, claiming unsafe working conditions. We should have known this was coming. You might remember at some point there was a lot of discussion on Capitol Hill about creating exemptions, and then you remember there was the big rally and they asked people to sign these waivers, right? The words waivers and exemptions are probably going to come up more and more because cases like this, these campus workers say, look, we don't feel safe about this. And you guys aren't doing everything you possibly can to make sure we are safe.
Well, and they were saying there's like it's 17 employees who filed the suit, class action suit. And they filed it on Monday, and they've got professors, they've got housekeepers, staff members, and they said an increased exposure. But they also they're three of the University of North Carolina colleges part of it, and they're also saying that one of the unions down there is representing some of the people saying that they have not been provided enough protective gear, which is interesting.
Well, we're hearing that. We're hearing that if there is going to be a second wave, we still have an issue with not having enough protective gear. We're hearing that from the hospitals. These are just essential workers. These are people who are trying to get up and go to work every day, make a living, and support their families. I get it. I'm not going to question their motives, right? I think that it certainly has caused some pause, and they're having to look at what's going on in North Carolina. And I don't think UNC is going to be the first institution or corporation. We're seeing this with some companies as well. I was watching this story play itself out with a corporation where the Department of Public Health jumped in and said, hey, um, having people on your campus working in their office by themselves is not remote working. Remote working is remote working, and they're working from home. So you're going to start seeing a lot of different interpretations. At the end of the day, people have to really kind of weigh and balance what is in the best scenario for them, their own personal health and safety, and their families.
So let's move on to Georgia. We talked about this story earlier with Governor Kemp and Mayor Keisha in Atlanta. Well, the governor has dropped his lawsuit against Atlanta over the mask mandate with coronavirus restrictions. Um, it seems like they've opened the line of communications. However, the governor is saying that he will sign an executive order today, Saturday, that's expected to tell local governments that they cannot order a private business to require masks. And there's going to be still a lot of people like, well, is this kind of like you're opening the door to people to just walk around without masks again? You know, each municipality to me should be able to control what's going on in their area, because if you're out in some rural area and there's only two restaurants within a mile, it's different from being in a place like Atlanta with thousands of restaurants there. So I guess we'll see what his order that he's signing today, what it's going to do.
Well, all my friends in Georgia should probably look closely at this photograph. It's interesting that the governor has on a mask. Enough said. And as far as the lawsuit, as the mayor of Atlanta, Mayor Bottom said, it was a waste of taxpayer dollars to even engage in that. I'm glad we're focused, and I tell people again to focus on this photograph and see what the governor's doing.
Mm-hmm. Okay. So we know that there are a couple of public health directors resigning. This one in California is because they're saying that there were errors in data. So an announcement that came from the California Health and Human Centers Services Secretary said that there was a glitch that caused up to 300,000 records to be backlogged, though not all of those were coronavirus cases, but there were some duplicates. So the problem is that this information affected the California Reportable Disease Information Exchange. So, I guess, it's so much going on, and it's like, okay, we get these numbers, but are you telling me there are more cases that were there, or there are fewer cases? And that's one of the things that people are, we have to go by the numbers when you're looking at science. So that's why that's important.
So the case out of California is one. I think the other one was out of New York. The New York health commissioner resigned after she clashed with the mayor. And then in South Carolina, in our state epidemiologist was reported to have said that the governor's office misled the public about the DHEC doctor's stance on COVID-19. We need to pay attention to these stories, because I think you're going to start seeing a lot of interesting shifting around. I think you're going to see a little bit of the blame game, because the numbers they remain to be staggering, and people are asking questions from the top down about decisions that were made, when they were made, when people spoke up, etc.
Well, um, down in South Carolina, this is your state epidemiologist.
It
And, you know,
is.
we've been asking different health professionals, national ones, about, you know, everyday life that they have. So
Absolutely. This was
the
that Seattle
question,
Post intelligence story that we talked about
yes,
last week. Yeah, yeah. And
yes.
I encourage people to read it because I'm always interested to see what the experts are doing, right? And in this case, they asked Dr. Bell when and where she wore a mask. And she talked about obviously doing it in the office setting and when she has encounters with people and she can't distance herself and during press conferences when she's not speaking. And then they even ask such intimate questions of these folks about who they let in their home and do they require the service people to do it or do they have masks on when the service people come in? And her take on this was, she allows the workers in the home and she doesn't make them mask while they're working, but she does when she comes, I guess, in contact to close out transaction. But interesting perspective. And they interviewed 5 of them and they're all very different.
Okay. So we've got a lot that's going to come ahead, and we will be back right after this.
In the midst of the battle against COVID-19, it's understandable that many Americans may experience heightened stress or anxiety, affecting our thoughts and emotions. But there are things we can do to stay mentally healthy during this pandemic, and resources for you and your loved ones to seek help. Hi, I'm Dr. Joshua Gordon, Director of the National Institute of Mental Health, doing my part by staying home. And here are 5 things to know about staying mentally healthy. First, try to avoid using alcohol or other drugs as coping mechanisms. They're really not all that helpful. Second, maintain routines for meals, exercise, and sleep. And try to stay active. Even 30 minutes a day of exercise will improve your outlook. Third, try exploring wellness programs like meditation, yoga, muscle relaxation, or breathing exercises. Schedule regular times for these and other healthy and relaxing activities. Fourth, reach out and connect with others for emotional support. Talk by phone to friends and family, chat outside with your neighbors while maintaining a 6-foot distance, and join virtual online gatherings to stay in touch. And fifth, seek help right away if you have trouble coping or feel overwhelmed, are using drugs or alcohol more frequently, or have suicidal thoughts. Your doctor may be able to provide a recommendation. Anyone can become overwhelmed. If you or a loved one is having thoughts of suicide, call the confidential toll-free National Suicide Prevention Lifeline at 1-800-273-TALK, available 24/7.
It's nice to see so many people getting different messages out. And we've been talking about the mental health, and
Yes,
we thought that was a good message to share with our audience because we know these continue to be stressful and trying times for people.
absolutely. And, you know, we want to welcome our guests that are watching too, and just make sure that you guys are paying attention to these public service announcements. They're not like little commercial breaks to go get a snack or anything, but to really dive in on the information. I know one of the things that we've been talking about too is school buses. And Carolyn, you were talking about the infection and tracking COVID-19 on school buses.
Yeah, this I think is an interesting story. I'm surprised this kind of tracking hasn't happened sooner, but they're looking at this as a way to perhaps track the young people that are getting on school buses. And if they determine that somebody has been tested and is positive, they can determine who all was on that bus, which I think is really smart. So we'll look to see, but I think we're going to see a lot of districts, gravitating to this kind of technology.
Absolutely.
That travel piece is raising a whole lot of different issues for folks, particularly if you're trying to travel domestically and outside of school, but domestically or even internationally. There are a lot of folks, we have a couple colleagues who have been living abroad and haven't been able to get back into some countries because of their concern about our situation here in the States. We have somebody, though, that has actually been traveling and living abroad for some time, and recently went back, and I saw an interesting post she had made on Facebook. This is Myra, who's from Houston originally, but is actually living in the Caribbean. And Myra Jones-Romaine is joining us from St. Kitts and Nevis, and she's in
Hello.
quarantine. Hi, how you doing?
Hi. Hello, hello. Thank you for having me.
Thanks for being
Thank
with us.
you.
I was intrigued by this. I mean, I knew you were going back and forth between Texas and the Caribbean islands, but I didn't realize. So you got off the plane and they immediately put you into quarantine?
Well, yes. So if you were coming from anywhere outside, the borders are closed. So they are only allowing citizens and residents. I'm a resident, and I had been in California. I got on the last commercial flight out in March because my daughters had called and said, you got to get here. There's this virus, and it's really dangerous. They're going to close the borders. You're not going to be able to get in, and we can't get to you. And there's just not much medical care here. It's more we love you care. But so they were just afraid for me to be here. So I literally on the 23rd of March got on the last commercial plane out of St. Kitts. And I went to California. I have a daughter in Sacramento and one in Oakland, and stayed there for 4 months. I kept trying to see when I could come back. Finally, it was clear that they were not allowing any commercial flights to come in anytime soon. So there is a process in which you can, if you're coming from anywhere, you have to apply. You tell them your status. They ask you to get tested, and you can only fly to a neighboring island, and I had to fly to a U.S. island. I could have gone to Puerto Rico, St. Croix, or St. Thomas, and then take a charter in. When you fly in, the police meet you here on the mat, and you are escorted into quarantine for 14 days. And so
you put up a couple of pictures of it.
Yes, and so
but
yeah. So these are actually medical school dorms. The medical school, it's an American medical school here in Nevis, and they're using the dorms because the students aren't here. They have them to leave. And so this is the roof of the medical dorm where I'm staying. And I walk there. That's where I do my exercise. And I get to see, the beautiful sunset, and, the ocean is right over there, and I get to see all of that. But it's not bad. I mean, a lot of people complain, but you have to understand that they are really doing a great job. St. Kitts and Nevis is COVID free, and they intend to keep it that way. It's going to be a little bit harder because they've got to figure out how to bring tourists in. But right now, they're allowing this 2-week quarantine. And then today, it was my 14th day. They took the test, and I'm waiting for my COVID-19 test results. If it's negative, I get to leave. And you'll see that there's not a lot of mask wearing around. Well, here in the compound, you have to wear masks, but outside, because there is no virus right now. But if you're inside, any event that you're inside, whether you're shopping or, going to the bank, you must wear a mask. But if you're just on the street and what have you, it's okay not to wear one. So they're doing really a great job. I just am enjoying the fact that, it has been a nice time to relax, not complaining, because I understand they have done what the U.S. should have done.
Myra, I had a question about what is your day like? How do you get your meals, or tell us about that?
Okay, so before you come, you need to, if you have family or friends, they have to buy the food for you, and they take it to what's called a disaster management office. And that office then brings the items, and they're waiting for you in your room. And you literally have to have everything. You need to have a plate, a fork, a spoon, a knife, a pot, The only thing they have is a bed. The room is about 20 by 20, but they have a bed, 2 desks, a hot plate, a microwave, and a refrigerator, and of course a restroom. And you know what? You have to have everything else, a broom and what have you. And so I quickly had all my friends get, all of that. And there is also a delivery service. It's kind of expensive, but we'll go shopping and bring food for you. But I've had friends who've been really great. They've brought me meals. They've, brought the groceries and all of the supplies. We have washers, dryers here, but I needed detergent and all of those things. But so I have it. But you do have to have, that's why you have to either be a resident or a citizen, because you need to have some connection to have the things brought here.
Well, you're looking good, and I know you come from long line of those who focus on health and well-being. I'm thinking of your late mother. May she rest in peace.
Yes, Dr. Edith Irvin Jones. Yes.
Her practice there in Houston. What are you doing to make sure you stay healthy?
Well, I'm in the wellness business. So every morning I get up, I do my yoga. I then go up and, I've been doing some work online. I've been taking a lot of courses to update COVID-19 procedures because I do massages. I also do classes, yoga classes, and Qigong classes. So I want to make sure that I'm doing all that I can to keep my clients, my patients safe. So I do that. I walk around. You can talk to some of the people here. You have to keep your distance. We've got about 30 people here right now. There's a whole nother setup in St. Kitts, but in Nevis, this is the setup. And I'm just connecting with people that I usually don't have time because I'm busy with appointments and running here and there. And so I'm really reconnecting with people, with friends. I am making sure to exercise. I'm eating well. They've brought me fresh fruit and vegetables, and meditating. I meditate a lot. And so in the morning, meditate. In the evening, I'm up there watching the sun go down, meditate. So I'm doing a lot of that. And so I encourage everyone to find a schedule for them that really takes care of them. You've got to have some self-care, because it is really important to keep your immune system strong, so that if you do come in contact with the virus, your body has some strength to fight it off.
Well, Myra,
I'm so glad we had a chance to reconnect. I hope your test comes back negative. I hope you get out of quarantine, and I hope I can come and see you in those beautiful sunsets soon.
Yes, thank you so much.
Take care of yourself. Be safe.
Right.
Wow.
all right.
It's quite an event. I mean, when I saw it, I was like, wow, this is an interesting setup. And for them to have no cases on the island. Wow.
Yes. So we're going to have some more public service announcements, and we'll be back right after this.
I'm staying inside for all of our at-risk loved ones, my grandparents, your grandparents,
my friends and family, and for you.
We stay here for you. Stay home for us.
You need to stay smart. You need to stay home.
Staying at home, social distancing, all these things that CDC is saying is going to help us get over this quicker.
Every infection that we can prevent helps to keep us as providers safe, helps to keep you as a member of the public safe.
I am staying home to help slow the spread.
Do your part in making this go away.
Stay home.
In order to come together, we must stay apart.
It sounds contradictory, but it makes a lot of sense.
Tell me you love me.
The first thing that I will do,
go dancing with my friends.
I'm going to hug my kids' teachers and tell them how much I appreciate them.
Stay home.
Stay home for us.
Well, we're back with the health wrap. Hey, Carolyn, you know it's the weekend, and usually people are going to concerts in the summer. Well, for a lot of artists, A-list artists and emerging artists, that hasn't happened because of COVID-19. I want you to take a look at a young lady named Ruby Camille and see what she's doing for summer 2020.
In the house with it. Summer 2020 gon' be different. A little different. In the house with it. In the backyard or on the couch. In the backyard chillin'. We in the house with it. When I leave my house, I come a mask in my best outfit. We in the house with it. Oh, we in the house. We in the house with it.
I never thought that we would even be here, staying in the house more than usual because we fearing the corona COVID-19 taking over the world. It's doing something we ain't never seen. And then on top of that, we protesting, fighting for our lives, cause you think we always got the weapon, but you guess it, the weapon ain't the gun. It's the color of my skin, black and brown, makes you wanna shoot and run. And on a different note, I got to know myself, sitting in my room making music, thank the ones that help. And on top of that, been having family dinner, we've been talking and laughing, and sometimes we even differ, but that's love. Love is what we need right now. Love is gonna help us rise above. We ain't never gonna forget this year, y'all. 2020, what's up? Cause we was where? In the house with it. Summer 2020, it's been different. While we were in the house with it, gotta thank the first responders for their dedication and their commitment.
I just love how she thanks the first responders. Hi, Ruby Camille.
Hi, how are you?
How are you doing? Well, I want you to tell us, first of all, how did you come up with this concept of the song and then the video?
So I graduated from college in December, and so that's when everything started happening. And so I came home, I had a show in February, and that's when things really hit with having to quarantine and just things were starting to close down. So in April, I started writing Summer 2020, but it was a joke, kind of, just because I saw a lot of people on Facebook and YouTube just coming up with funny things to just, lighten up the mood for something that's really, really serious. And so as the summer continued to go on, I saw that this is, things are shutting down, people are getting sick. And I think this song should really be a message to tell people to wear a mask, to social distance. And even I got to be a part of a protest. And so, of course, I put that in there as well, because that has been a highlight of what this world has been going through. So this year has been tough, but empowering at the same time.
I know that you had a lot of things that were canceled, including that you were going to do the national anthem for the Nashville Predators, the hockey team here. And then you decided to do something else yourself and have your own little concerts.
Right. So we put a team together this year with Caldwell Plus Records, and we decided to come up with an online concert on Instagram Live and Facebook Live, since I could not perform anymore. And since I'm a new artist, still putting my name out there so people can just let them know that I'm still here, even though I've been set back a little bit. And so we started a show called Rock with Ruby in May. And so it covered all of May. And so there were categories like my favorite women in the music business, favorite male artists, gospel week, and I even did a week of my own music. And so we really grew throughout all of May, and people got to see, Ruby Camille and how she's grown since she's graduated from college. So it was an awesome experience, and the team really came together to make it happen.
Wow.
Last thing, ask you about the message to young people about wearing masks.
One more time.
What can you say to young people about wearing masks?
I mean, young people are very not stubborn, but we stand in what we want. And so, I have a lot of friends that won't wear them, and then I have a lot that do. And so we have to be conscious of other people around us. And, we can, like I say in the song, wear your mask in your best outfit. You can dress it up, but we just have to be safe. And, I tested positive for COVID last month. So yes, I was always wearing a mask and, doing my best to social distance, but I was affected. And so I definitely promote wearing a mask and social distancing because it's real. and it's happening. And I just was very thankful that I didn't have any symptoms and I didn't spread it to anybody in my household.
All right. Well, thank you for joining us. And we're going to end the health wrap and with summer 2020.
Thank you.
And thank you for watching.
Summer 2020 gon' be different. In the house with it. In the house with it. Summer 2020, what's up? We've been getting ready for the summer. Such a shame, what a bummer. We just got the worst news, but something's taking over. Been training for my summer body, on the beach blasting and riding rich. But now we gotta be at home. As long as I got my family, won't be alone. But I'ma make the best of it, while I have the rest of it. Even if that means I gotta buy something and lay it out like I'm at the beach with it. We gon' make it work. This year's gonna be something to remember. But this is where I'm gonna be. We in the house with it. Summer 2020 gon' be different. We in the house with it. In the backyard or on the couch with it. We in the house with it. When I leave my house, I got my mask and my best outfit. We in the house with it. We in the house with it. When will it all be over? Cause it's getting kinda scary. Cause I wanna go out. Dress up, have fun, just be classy. On a serious note, I need a job. Start at the bottom, but I'll get to the top. Got bills to pay, I'ma make a way. Taking it just day by day. But I'ma make the best of it, while I have the rest of it. Even if that means I gotta buy something and lay it out like I'm at the beach with it. We gon' make it work. This year's gonna be something to remember. This is where I'm gonna be. We in the house with it. Summer 2020 gon' be different. A little different. We in the house with it. In the backyard or on the couch. In the backyard chillin'. We in the house with it. When I leave my house, I put my mask and my best outfit. We in the house with it. Oh, we in the house. We in the house with it. I never thought that we would even be here, staying in the house more than usual because we fearing the corona COVID-19 taking over the world. It's doing something we ain't never seen. And then on top of that, we protesting, fighting for our lives, cause you think we always got the weapon, but you guessing the weapon ain't the gun. It's the color of my skin, black and brown, makes you wanna shoot and run. And on a different note, I got to know myself, sitting in my room making music, thank the ones that help. And on top of that, been having family dinner. We've been talking and laughing, and sometimes we even differ, but that's love. Love is what we need right now. Love is gonna help us rise above. We ain't never gonna forget this year, y'all. 2020, what's up? Cause we was where? In the house with it. Summer 2020, it's been different. While we were in the house with it. Gotta thank the first responders for their dedication and their commitment. We in the house with it. Before you leave your house, grab your mask and your best outfit. We in the house with it. Yeah, we in the house. Where? We in the house with it. Summer 2020 gon' be different. A little different. In the house with it. In the backyard or on the couch. In the backyard chillin'. We in the house.